Welcome to another episode of Spotlight on Wawarsing. I'm your host, Lauren, and tonight we are joined by Tom McCary and Izetta Briggs-Balling from the Institute for Family Health, which operates federally qualified health centers here in Ellenville, as well as around Ulster County, in Dutchess County, and New York City. Tom is the Director of Substance Abuse Prevention, and Izetta is a mental health clinician who specializes in care coordination for those receiving medication to help treat substance use issues. They will be sharing with us some information on substance abuse issues, how their community health centers are providing integrative care to better address substance abuse issues, and how we as a community can work together. Could you guys give us a bit of an overview on what we'll be talking about tonight in the show?
Sure. Lauren, first, thanks for having us on the show. This is very exciting. And obviously, talking about substance abuse issues is not necessarily the most fun topic, but it's also a very important one, right? So, and it's unavoidable. What we know is that over the course of individuals' lives, about 7% may experience an addiction problem over the course of their life. And this is also something which affects our community here in Ellenville and around Ulster County very seriously. We don't have to go far to hear in the news about someone having an overdose, and I would venture to say that it would be tough to find someone watching this show who has not been affected in some way through either personally or through friends or family or someone they know with addiction. So it's a topic which we feel very important to talk about, and what I'd really like to communicate, if nothing else, three main points, right? Prevention works, there is effective treatment, and recovery is possible. So within that, we hope to provide the audience with some practical information about substance abuse and substance use prevention, as well as how we look to integrate care within the context of primary care and mental health services within our community health centers.
So for those who don't know what substance abuse is, can you tell us a little bit about it?
Yes, well, substance abuse is actually an individual that is using substances in a manner that is harmful to them. So a lot of times we think of substances such as marijuana, it could be cigarettes, alcohol, but another level of it is also medications. So people are using prescription medications in a non-medical manner, which is also falling into the realm of substance abuse.
What are the different types of substance abuse? I know you mentioned like people use marijuana, but what are the different kinds of types?
So there's, do you mean like the different categories that substances
Yes.
fall into? Okay, so there are stimulants, which could be a medication such as Adderall, which is used for a legitimate medical reason, but it can be used in other ways. Then there are depressants, which alcohol falls into that role, and opiates can also fall into that role. And then there are amphetamines and drugs like cocaine. So an amphetamine is a medication, and cocaine is a substance that is usually bought off the street. So when I mentioned opiates, there are two forms. There's opioids, which is prescription medication, which could be oxycodone or a Percocet, something that we kind of hear of all the time, or a hydrocodone. And an opiate is usually a synthetic medication, or it could be actually the street drug, which is heroin.
What are the different kinds of symptoms that could be noticed for anyone who's doing?
Well, there are a few, and what we try to get people to recognize within their households or within individuals that they work with is some change in their behavior. So if there's someone that is an A student, and they've pretty much been an A student for the majority of their lives, and they start to not want to go to school anymore, their grades are slipping, there's a dramatic change with the individuals that they are starting to socialize with, that might be a conversation that you might want to have a conversation, and somewhere in that conversation begin to address the potential for some type of substance use or misuse.
For someone who wants to, there are a lot of people who pretty much deny substance abuse, right? Like if they have symptoms or is anything of that sort, how do you get them that type of care to treat that?
Tom, would you like to answer that?
Sure. Well, that's a good question, right? And I think that's something that conversations can take place in many different ways, right? And when we're talking about thinking about it in the realm of prevention, this can be within families as well, right? So having parents talking with their children about the risks and dangers of substance use, or if they're noticing significant changes in their child's functioning. There's a lot of good resources out there on how to use age-appropriate language and talking with younger people about substance use. And so it's a topic which definitely pushes buttons. I think you kind of were suggesting that, right?
Yeah.
Like people might deny that they were using or having issues with, and a lot of that comes with how you present yourself to the other person, and trying to maintain having a non-judgmental stance, right? Having it talking about it within the context of what you observe, and this starts with being respectful in how you talk with people, and then also being open to what you hear back, right? I can't ask someone a question and then have a very critical response when I hear an answer, because they're not going to tell me anything else after that.
Yeah.
So really kind of setting the stage that this is something that is okay to talk about, and we're going to, that it's a safe place, and that if I can't help you, I'm going to help find you the help that you need.
Well, some of what I'm about to ask was kind of answered, but besides the fact this is some scary stuff, you mentioned prevention. So how does that exactly, how can you get that?
Great. So, right, we want to convey that prevention works, right? So prevention can take on many different forms. Prevention, when we think about it, it's trying to stop something before it starts, right? Or make it not as bad as it could be. So I'm preventing something from getting worse. And that can happen on the individual level, like what we were talking about, open discussion and dialogue, as well as education. So learning individuals to learn about the risks of using substances. Then it can also happen on the community level. And here in Ulster County, there's a lot of great prevention work. There's the Ulster County Community Forums, which are sponsored by the Office of Mental Health and Hygiene here. There's the Ulster Prevention Council, and there is also an interagency task force on alcohol and substance abuse prevention. So within the community level, there is prevention efforts, and then also things that happen on the state and government levels. So things like laws and legislation. And then within the medical fields, there's also prevention, which falls under things like safe medication practices. Mm-hmm. So when someone goes to have their wisdom teeth taken out, they don't go home with a 2-month supply of pain medication, mm-hmm. right? Prevention also includes things like medication take-back opportunities. And in Ulster County, there are medication take-back boxes. So we'll have some information at the end of this video with locations on where people can dispose of unused medications. There's some pretty unfortunate facts which go along with that medication take-back. And this was coming from a survey in 2014 and 2015. It was a youth development survey done right here in Ulster County. Mm-hmm. And what came from that was that about 15% of middle school students mm-hmm. said that it was very easy to get prescription medications that mm-hmm. were not prescribed to them. 30% of high school students said that it was easy to get prescription medications. So, and 6% of students said that they had used prescription pain medication within the last 30 days. So getting unused medications out of the medicine cabinets and disposed of is, one great way to prevent substance use and misuse.
And just to piggyback off what Tom is saying, another form of prevention is normalizing the conversation, which is kind of like what we're trying to do here. We're trying to get the word out and have the conversation. And the younger that conversation can be started with people, the better, because research also indicates that the longer the onset before someone starts to use a substance, the less likely they are to become dependent on a substance. So if people are educated, families, and communities are educated together, then collectively they can help the next generation to lead a more drug-free type of lifestyle, which means that medications will be given, like when someone goes to the doctor, to the dentist for a tooth or some kind of minor procedure, that they would not initially be given medications that they could become dependent on. And families would be educated that there are other ways to work through maybe a child having a headache than giving a pill, because that behavior reinforces, the ability to want to use a substance to get a quick response to an uncomfortable feeling.
Well, I didn't see any of this coming, but do doctors, I know I've taken like Tylenol and like Advil and things of that sort. Is it possible those could be used to like a worse effect than they already are, or anything of that sort?
Well, that's a good question, right? You want to, things like Tylenol generally doesn't cause a lot of dependence, meaning that somebody would become addicted to Tylenol, but if it's not used correctly, it certainly could have physical effects on your body.
Mm-hmm. And you could also you could also feel like, well, I've been taking Tylenol for a long period of time, so I don't know if they're working as effectively, and you might want to take something else. So the more you prolong using something, the better it is for you. Not that everything is dependent, but it could reinforce a behavior that could lead to some type of problem going down the line.
So do you guys believe that there's a lot of children in Ulster County or in America that do deal with substance abuse?
Well, the research does indicate that a substantial portion of adolescents and young adults are using medications or illicit substances in a problematic manner, more than we'd like to see. Because really, if only 10 people are using in a problematic manner, that's too many, because we want our young people to be healthy, and we want the next generation to be healthy as possible.
There's a very good report, and there's a huge initiative in New York City right now, and a big report came out of that, and one of the statistics which I found very striking was that there are about 7,000 emergency room visits a year related to underage drinking. Mm-hmm. And so that struck me as a pretty significant fact.
Mm-hmm. And there's also increasing evidence to support that younger people are using also prescription medications more problematically, and the emergency rooms are now collecting that data so that can be added to some of the youth development surveys and monitoring the youth surveys, so that information is available as well. So it is a growing concern.
Do you guys plan on doing any types of like foundations or different types of movements or community service that could start more prevention for kids our age, or actually anyone, since substance abuse seems to be a worldwide problem?
Well, I think what we're doing right now and bringing this message out to the community, and also more and more the norm is becoming that these are the types of questions and these are the types of conversations that young people of all ages, that their doctors, their counselors, whoever they're meeting with for regular care should be asking these types of questions, right? Because we can't just think that this is not something which people are experiencing, right? And so it's to say that it really is the responsibility, if these are not the conversations that a medical or a mental health worker can ask a patient, it's communicating a message that this is not something that we're going to talk about. This is not something which is a safe place to talk about these things, and it's not, and so that would be the opposite of integrative care, right? We gave the introduction as saying this is how more and more the medical industry is becoming more important to work together, right? So that although you may be going to the dentist, that dentist should ask you about tobacco use, right? A lot of people see the dentist twice a year and never go to a primary care doctor because they don't get sick. So thinking about things like that, we're trying to communicate that it's everyone's responsibility to have the conversation, right? If you're getting ready to make a prescription, you should also be communicating the risks of that prescription. We know a lot about risk factors for developing substance use issues. So if we know that someone has some risk factors, we should be asking additional questions. Even if we might not be the right people who are going to continue giving care, there's an idea or a way of doing things now which is called no wrong door, right? So it's my responsibility to ask the questions, even if I'm not going to ultimately be the one providing that ongoing care for someone. The idea is that I'm going to help you or make sure that I help you get to the help that you need. And that can happen at any level, and it should be.
Now, forgive me for pronouncing this wrong if I do, but I've heard of something called Suboxone or something. What is
Suboxone?
Yes, I'm so sorry, but what is that exactly?
Well, Suboxone is actually medication. It's called medication-assisted treatment. So it's a medication to assist individuals that are dependent on either opioids or opiates, which we kind of explained a little bit before. So what it actually does is it's a medication that attaches to the brain receptors, and the purpose of it is to block the effect of the substance if used, and also it reduces the withdrawal symptoms. So it actually helps an individual that is dependent on the substance to not want more, and it helps them to deal with the negative physical effects of not taking more.
Wow. That just put everything into perspective. But is there anything else you guys want to share with us, or anything else you think the world really does need to know since you're here with us?
Well, I just wanted to say that the Institute, because you did ask how are we working with the community to address some of these issues. And it seems like the Institute is really committed to addressing the issue of substance use, misuse, and treatment in every aspect that they can. The Institute is in the community. The resident doctors are being trained in reference to non-medical prescription drug use, as well as how to do a brief assessment for each patient that comes in. And the dental program is also being educated. So it's an integrated care addressing substance use and misuse is being integrated in every level of care at the Institute for the community.
Tom?
Well, right. So we want to communicate that. So we talked a bit about prevention works. There is effective treatment. So Izetta works intimately with assisting people who are are using medication-assisted treatments. There are other effective treatments as well. So medication works best when it also is used with counseling, right? So having that relationship between getting evidence-based counseling and so there are things like groups, individual care. There are resources in the community when a patient might need a more hands-on or more than we would be providing. There's also peer support groups and mutual support groups as well. So there are many forms of effective treatment, and we also want to convey that recovery is possible, right? We see people who are getting their lives back, right? That are getting better. They're maintaining their health and wellness, and that recovery from alcohol or substance use now is also being considered more and more like a chronic illness, right? Something like asthma or diabetes, where a person can maintain wellness, but they need to continue doing things, right? So you have to, just like with diabetes, you can live very healthy and maintain your wellness through medication and diet and exercise. For alcohol and substance use, the same might be said, right? It might not involve long-term medication, but there are other things that people are going to develop as part of their recovery lifestyle, so that if they stop doing those things, they would be at greater risk of having a slip or a relapse, or just not be as emotionally well over time. So even long after the perhaps crisis of the alcohol or substance use is further into that person's past, there will still be things that they continue to do to keep themselves well. And we would consider that a recovery lifestyle, the things that I continue to do to keep myself well. And it's a lot easier to stay well than to get well. It takes a lot more work in the beginning, but you need to keep doing work to keep it going. Just not as much.
It seems like a routine, but before we wrap up, can you guys actually tell me the difference between your two jobs? It seems like they're very well connected, but I wanted to know if there was an exact difference or anything.
Sure.
Well, my role is I actually meet with the patients, and I connect them to the services that they need, and I interact with the medical doctors to ensure that their service provision is appropriate and accurate for their level of need.
Okay.
Throughout the sites that I work at.
God bless you.
Thank you.
Yeah, Izetta does great work, and it's really it's so important to have that familiar person that helps you through the process, right? Because many of these patients and people it's so easy to have the door shut in their face, right? It's really easy to feel not wanted and not cared for. And so to have someone who so compassionately understands and cares and works with someone over time can makes the world of difference. And treating someone like a person, right? So as the director of substance abuse prevention, I also work individually with patients, and then some of the other time I work with outside agencies and who we collaborate with, and then I also work. We have a very large organization, and so developing and improving the the practices and the ways in which we do things internally, training staff on how to ask the right questions and improving how we document and work with patients.
Wow, SAP, substance abuse prevention. I
That's-
like that, guys. You should brand that.
All right, you can hashtag that.
Oh, I forgot that's a thing, hashtags. But thank you guys for coming tonight. I'm so glad I got to know more about substance abuse and exactly what you do, which clearly in America needs to be more aware of. But that's it for tonight on Spotlight on Wawarsing. I'm your host, Lauren, and good night, guys.
Good night.
Good night.